This video only covers selected highlights of the RemunityPRO Pump User Guide and is not intended to replace the user guide. For complete details, including warnings and cautions related to the RemunityPRO Pump, refer to the user guide. For safety information related to Remodulin, please see the end of the video and the full prescribing information. In this video, we will cover tips and best practices to follow when traveling with the RemunityPRO Pump, and the second part will cover preparing for an MRI. Traveling with the RemunityPRO system requires planning ahead. Discuss your supply needs with the specialty pharmacy to ensure that you have enough to cover your time away. Be sure to bring a few extra supplies for unplanned occurrences. When traveling outside the country or for long periods of time, be sure to take extra supplies including a battery charger, wall power adapter and travel adapter, USB cables, extra medication, and a letter from your healthcare provider explaining the medical need for your pump and other supplies. Before traveling by plane, contact your airline to confirm their policies and required documentation, as each airline may vary. Familiarize yourself with the airport security procedures. Airport security checks and screening procedures may change, so review the airport website and the TSA website for travel updates before your trip. Also, be sure to plan extra time. To prepare supplies for the security process and flight, pack supplies and carry-on luggage. Do not pack supplies in checked luggage as it could get delayed or lost. When traveling, alternate pump batteries must be protected from damage to prevent a short circuit from occurring. While packing carry-on luggage, secure pump batteries in the battery charger by using a piece of tape or rubber band. The RemunityPRO system should not be exposed to X-ray screening use for carry-on and checked luggage. Airport security offers the option of requesting a visual inspection of your medical supplies rather than putting them through the X-ray. Request this before the screening process begins, and be sure to plan extra time for security. The RemunityPRO system has been designed to withstand common electromagnetic interference, including airport metal detectors. For the visual inspection process, your medical supplies should be in a separate bag when you approach the security officer. This chapter covers tips and best practices to follow when preparing for an MRI. The RemunityPRO system is not magnetic resonance safe and should not enter the MRI scanner room. If you need an MRI, first notify the MRI facility that you are on a continuous infusion and the pump is not MRI compatible. Ask the facility what they require prior to undergoing an MRI. With that information, discuss with your healthcare provider how to undergo the MRI safely and create a plan. The RemunityPRO user guide provides MR unsafe cards with contact information in case any additional questions arise. For questions, reference the RemunityPRO user guide or contact the specialty pharmacy or your healthcare provider. RemunityPRO Pump for Remodulin Treprostinil Injection. Indication: the RemunityPRO Pump for Remodulin Treprostinil Injection is intended for continuous subcutaneous delivery of Remodulin Treprostinil Injection for use in patients ages 17 and older. Important safety information for RemunityPRO. Warnings and cautions. Do not use the system outside the conditions listed in the user guide. Retain the user guide for future reference. Refer to the user guide for all warnings and cautions. Failure to comply with the following warnings and cautions may result in harm. Limited to use with Remodulin. Only RemunityPRO cassettes may be used with the RemunityPRO Pump. RemunityPRO Pump is for use only with FDA-cleared infusion sets. Medtronic Quickset Infusion Set, MMT-392, MMT-393, Naria Guard, 704060-5229, 704060-5226, Medtronic Silhouette Infusion Set, MMT-373, and Smith's Medical Clio 90 Infusion Set, 21-7-230-24, 21-7-220-24. Do not use disposables from previously opened or damaged sterile packaging, damaged disposable components, or expired sterile components. If the pump or remote fail to work as detailed in the user guide, stop using the pump and remote and switch to the alternate pump and remote included with your system. Only use the supplied cables with your RemunityPRO system, as other cables could interfere with pump function. Disconnect the infusion set tubing from your infusion site before removing the cassette from the pump. Avoid exposure of your pump and cassette to temperatures below 41 degrees Fahrenheit, 5 degrees Celsius, or above 104 degrees Fahrenheit, 40 degrees Celsius. The pump may affect nearby electrical and electronic devices, including medical devices, cell phones, Bluetooth devices, RFID readers, Wi-Fi equipment, and strong magnetic fields, causing these devices to operate abnormally or to stop functioning. Keep the pump, remote, and battery charger at least 12 inches, 30 centimeters, away from electrical, medical, and wireless devices. Do not open, crush, heat above 140 degrees Fahrenheit, 60 degrees Celsius, or incinerate the pump battery or remote, as doing so can lead to fire, burns, and property damage. This system supports flow rates between 8 microliters per hour and 225 microliters per hour. If the required flow rate is outside this range, discuss with your specialty pharmacy or healthcare provider. Prescription information. Caution: federal law USA restricts this device to sale by or on the order of a licensed healthcare provider. Use of this device without the training and supervision of a healthcare provider may lead to errors that result in harm. See the RemunityPRO pump for Remodulin treprostinil injection user guide for further detailed important safety information including warnings, cautions, and instructions on how to properly use the system. For further information, please call United Therapeutics Corp at 1-844-864-8437. The RemunityPRO pump for Remodulin treprostinil injection is manufactured for United Therapeutics Corporation. You may report side effects to the FDA at www.fda.gov/medwatch or call 1-800-FDA-1088. Remodulin treprostinil injection. What is Remodulin? Remodulin is a prescription medication used to treat adults with pulmonary arterial hypertension, PAH, WHO Group 1, which is high blood pressure in the arteries of your lungs. Remodulin can reduce symptoms associated with exercise. Remodulin was studied mainly in patients with NYHA functional class 2 through 4 symptoms. It is not known if Remodulin is safe and effective in children. In people with PAH who need to switch from epoprostenol, Remodulin is approved to slow the worsening of symptoms. Important safety information for Remodulin. Before you take Remodulin, tell your healthcare provider if you have other medical conditions or take other medicines that may affect your use of Remodulin by increasing the risk of side effects or decreasing the drug's effectiveness. Have liver problems. Your Remodulin dose may need to be adjusted if you have liver problems, have low blood pressure or bleeding problems, are taking gemfibrozil for high cholesterol, rifampin for infection, or other drugs that affect liver enzymes. Your doctor may need to adjust your Remodulin dosage. Are pregnant, breastfeeding, or planning to become pregnant. It is not known if Remodulin will harm your unborn baby or if Remodulin passes into your breast milk. What are the serious side effects of Remodulin? Continuous intravenous IV infusions of Remodulin delivered using an external infusion pump with a tube placed in a central vein within the chest are associated with the risk of bloodstream infections and sepsis, which may be fatal. Therefore, continuous subcutaneous SC infusion delivered just beneath the skin is the preferred type of delivery. Worsening of PAH symptoms. Do not stop taking or greatly reduce your Remodulin dose without consulting your doctor. Low blood pressure, symptomatic hypotension. If you have low blood pressure or are taking drugs that lower your blood pressure, the risk of low blood pressure is increased. Bleeding problems. Remodulin may increase the risk of bleeding in people who take blood thinners, anticoagulants. What are the possible side effects of Remodulin? In clinical studies of SC infusion of Remodulin, most people experienced infusion site pain and infusion site reaction, redness, swelling, and rash. These symptoms were sometimes severe and sometimes required treatment with narcotics or discontinuation of Remodulin. IV infusion of Remodulin delivered through an external pump has been associated with the risk of bloodstream infections, arm swelling, tingling sensations, bruising, and pain. The most common side effects seen with either SC or IV Remodulin were headache, diarrhea, nausea, rash, jaw pain, widening of the blood vessels, vasodilatation, and swelling from fluid retention, edema. These are not all the possible side effects of Remodulin. Call your doctor for medical advice about side effects. You may report side effects to the FDA at www.fda.gov/medwatch or call 1-800-FDA-1088. The risk information provided here is not comprehensive. To learn more about Remodulin, talk with your healthcare provider. Please see full prescribing information at www.remodulin.com or call customer service at 1-844-UNITHER, 1-844-864-8437.